for the cross table hip, cross table femur, this is if the patient has that foreshortening of the leg or that external rotation or their trauma, you're going to do this. So we're going to first log roll the patient so that we can build up that hip so that we don't clip it. Then we're going to pull the tube out. I try to get everything lined up as much as I possibly can before I start moving the patient because they're in pain. Now, if you are doing the cross table hip for the femur or for the hip, you want to make sure that your pelvis is done at a 48-inch SID. So what I'm going to do is we're still going to center at the crease of the hip. So I'm going to raise up the unaffected hip to find where the crease is, and then I'm going to match it right here. So here's the crease of the affected hip. So this is going to help me rotate so that I'm perpendicular through that hip area. So I'm just looking at the line here and ensuring that my finger is running right down that line. Okay. Then I'm going to make sure that I'm at a 48-inch SID. Okay. Now it's important that you stay at that 48-inch SID because you have to do plus 10 kV and you have to double your mass from your good AP pelvis or AP hip. So your 48 inches needs to be for your pelvis and for your cross table hip. So now that I have everything just about where I need it to be, I'm going to start raising the unaffected leg. So you have to have some sort of device to hold the patient's leg up. Because we want to make sure that the soft tissue is out of the patient's anatomy. You see how we're coming right in, right there, through that femoral neck. Okay, so you want to try to put the gown in between the patient's gonadal area here, because most of them aren't going to be wearing underwear or anything for patient modesty. Okay, but this is where we're trying to come into, so that you're perpendicular to the neck. And I'll just raise it up so you can see it. Now I'm going to set up the plate. I do that last because it's expensive. So when you're doing the plate has to be, the face of it has to be parallel to the face of the x-ray tube to ensure that your beam is going to be perpendicular to the IR. And you can put it in this grid holder if you want to, or have your patient just hold the plate up for you. But make sure that it lies parallel. Okay. Then I'm just going to check my collimation here. Place my marker. Shield is going to go right up here because we can't shield the gonadal area. And then I would make my exposure.